Anorexia nervosa. Anorexia nervosa is an eating disorder. It's a serious, potentially life-threatening, mental health condition. It can affect people from all ethnicities and backgrounds. It can also occur at any age, but most often starts in your teens and early adulthood. Sometimes people with anorexia nervosa don't realize how serious their condition is, which may make it more difficult to seek help. People who have anorexia nervosa are very concerned with their weight, body shape, and the amount of calories they eat and drink. They may limit what they eat and drink and develop lots of rules around it. They may also exercise excessively. They may also use other methods to try to control their weight, like using laxatives or making themselves sick after eating. Symptoms of anorexia nervosa. Anorexia nervosa can have a range of symptoms. Most of the time people won't have all of these. Symptoms include: if you're under 18, your weight and height may be lower than the healthy range expected for your age. If you're an adult, you may have an unusually low body mass index, BMI, or rapidly lose weight over a short time. Severely restricting food, drink, and calories so that your body doesn't get the nutrition it needs. Thinking about food a lot. Being very careful about what you eat, such as avoiding eating any foods you see as fattening or unhealthy. Making yourself sick after food or using drugs like laxatives or weight loss medication. Believing you're overweight when you're a healthy weight or underweight. Avoiding looking in mirrors or wearing baggy clothes. Constantly checking your weight and comparing yourself to others. If you get periods and you have anorexia nervosa, your periods may stop. Doing an excessive amount of exercise. Physical changes, like feeling lightheaded or dizzy, hair loss, or dry skin. Feeling tired and cold. Changes to your bone density make them more fragile and more likely to break. Difficulty concentrating, which affects your work or study. Changes to the way you think, which may include making very strict rules for yourself. Compulsive checking of ingredient lists and nutrition labels. Having rigid food rules and beliefs. Criticizing others' food choices. Fixation on eating foods that are considered healthy or clean. You can never tell how unwell a person is from just their weight or BMI. In children with anorexia nervosa, puberty and the associated growth spurt may be delayed. They may gain less weight than expected for someone going through puberty. Getting help for anorexia. Speak to your GP practice and ask for an urgent appointment if you think you have an eating disorder like anorexia nervosa or are experiencing symptoms like rapid weight loss, very low weight, collapsing or fainting, dizziness, tiredness or fatigue, weakness, dehydration, muscle spasms, pins and needles, irregular heartbeat, arrhythmia, chest pains, high levels of distress like feeling really upset, agitated and uncomfortable. Have more information on planning an appointment, how to talk to your GP and what will happen at an appointment. If you feel like it would help you, you can take a friend or family member to your appointment. It can be difficult to know what the right questions to ask at an appointment are. It's okay to ask has some ideas that may be helpful. Helping someone else with anorexia nervosa. If someone close to you is showing signs of anorexia nervosa, you can offer help and support. You could try talking to them about how they feel, and encourage them to think about getting help. Try not to put pressure on them or be critical of them, as this could make things worse. You could also offer to help by going with the person to see their GP. Anorexia nervosa can often make people think they are making positive changes or are not as ill as they are. They can be unable to recognize the harmful effects of anorexia nervosa. This can be a challenging conversation to have with your loved one. If you'd like to get some advice on how to help, speak to a healthcare professional for information on how to help the person recognize that they have a problem. The treatments available. How you can support them during their treatment. BSL has more information about how to support someone with anorexia. Supported have information on caring for someone with an eating disorder. Cared have information for families and carers of people with eating disorders. Feast have information for parents of those with an eating disorder. Diagnosing anorexia nervosa. When making a diagnosis, your GP will probably ask questions about your weight and eating habits. For example, they might ask if you've lost a lot of weight recently or quite quickly. Ask how you feel about your weight, and if you're worried about it. Ask if you make yourself sick regularly. Check if you have periods, whether your periods have stopped and if so, for how long. Check your weight. If this feels frightening, you can request that you are not told your weight. Check your pulse and blood pressure. Do a blood test. It's important to answer these questions honestly. Your GP isn't trying to judge you. They just need to accurately assess your symptoms. Have more information on planning an appointment, how to talk to your GP and what will happen at an appointment. Referral to a specialist. If your GP thinks you may have anorexia nervosa, they'll refer you to a specialist in eating disorders for a more detailed assessment. If you're not referred to a specialist service, there is support available to you through services like BEAT. Supported. Treatment for anorexia nervosa. You can recover from anorexia nervosa, but it may take time and recovery will be different for everyone. There are effective treatments for anorexia nervosa. Recovery usually involves working with a mental health team and will include dietetic support and talking therapies. Some people may also need additional support around their physical health or other treatments. It's important to start treatment as early as possible to reduce the risk of serious complications. Treatment for anorexia nervosa is slightly different for adults and those under 18 years old. The Psychological Therapies Matrix for Anorexia Nervosa explains what therapies are most likely to help you based on your needs and the current evidence. Cognitive Behavioral Therapy, CBT. You might be offered cognitive behavioral therapy, CBT, either individually or as part of a group. CBT starts with the idea that thoughts, feelings, and behavior are linked and affect one another. Family-based treatment. Family-based treatment, FBT, involves the whole family in solving their child or young person's eating disorder. During FBT, parents and carers are an essential part of the solution and members of the treatment team. Interpersonal psychotherapy. Interpersonal psychotherapy explores the link between relationships, feelings, and eating behaviors. Psychological treatments for children and young people. Family-based treatment, FBT, involves the whole family in solving their child or young person's eating disorder. During FBT, parents and carers are an essential part of the solution and members of the treatment team. CBT may also be used. It can be tailored for young people experiencing bulimia nervosa. BEAT has more information about treatment for anorexia. Sign guidelines for eating disorders. Complications of anorexia nervosa. Anorexia nervosa can cause other physical health complications. Some people can be at higher risk of physical complications. This means they should be regularly monitored by a healthcare professional. This includes people who have a very low weight, lose weight quickly, are making themselves sick several times a day, are regularly using laxatives. People with anorexia nervosa have an increased risk of Health problems caused by malnutrition. An imbalance of vitamins and minerals. Problems with the heart and blood vessels, including poor circulation, an irregular heartbeat, low blood pressure, heart valve disease, heart failure, and swollen feet and legs, edema. Having a weakened immune system or anemia. Low blood sugar levels, hyperglycemia. Kidney, liver, or bowel problems. Problems with muscles and bones, including feeling tired and weak, osteoporosis, fragile bones, and problems with physical development in children and young adults. Problems with the brain and nerves, including difficulties with concentration and memory. Loss of sex drive, libido, and impotency in men. Dental problems, like tooth decay caused by regular vomiting. If you feel unwell with any of these symptoms, you should contact a healthcare professional. Refeeding syndrome. Refeeding syndrome can happen when someone who is malnourished starts eating. If food is introduced too quickly, it can cause serious complications due to an imbalance in vitamins and minerals. It's important to speak to a healthcare professional if you're significantly malnourished and are starting to eat again. They will be able to help you safely introduce food. Anorexia nervosa and pregnancy. Anorexia nervosa can lead to irregular menstrual cycles, periods, or cause your periods to stop altogether. Your period should return during your recovery when you're at a healthier weight. You should continue to use birth control if you aren't planning a pregnancy, even if your periods are irregular or have stopped. If you have anorexia nervosa and are trying to become pregnant, you should discuss this with your GP and care team. Anorexia nervosa during pregnancy can increase the risk of complications, like miscarriage, giving birth early, premature birth, having a baby with a low birth weight. You're also likely to need extra care and support during pregnancy if you have previously had anorexia nervosa and recovered from it. You should discuss this with your midwife. Further support. Find information and services that can offer advice and support about eating disorders.